Hello, everyone. I'm Carrie Thibodeau, National Director of Programs and Public Policy at the Kidney Foundation. I'd like to welcome you to today's webinar, Tips to Reduce Financial Stress of Kidney Disease. Before we get started, we'll need to just go over a few quick items so that you know how to participate in today's event. We're offering this webinar bilingually using simultaneous translation. During the presentation, speakers will present in English. To hear the presentation in French, though, choose French as your language preference in the interpretation icon in the Zoom toolbar.
Nous proposons ce webinaire dans les deux langues en utilisant la traduction simultanée. Pendant la présentation, les intervenants s'exprimeront en anglais. Pour entendre la présentation en français, choisissez le français comme langue de préférence dans l'icône d'interprétation de la barre d'outils Zoom.
You've joined the presentation listening with your computer's speaker system by default. If you prefer to join over the telephone, select the arrow next to the mute, unmute icon on the bottom of your screen in the Zoom toolbar. Select switch to phone audio and then select phone call and follow the prompt to dial in. By default, all participants enter the webinar with audio muted. Today's webinar is being recorded. For those of you joining on your computer, you'll have the opportunity to submit text questions to the presenters by typing them into the Q&A pane found in the Zoom toolbar at the bottom of the meeting window. Please avoid using the chat box to submit your questions. It helps us to monitor them more effectively when they're all submitted in the question pane. You may send in your questions in either French or English at any time during the presentation. We'll collect these and address them during the Q&A session at the end of the presentation. To protect your privacy, when you ask a question, please don't use your name or provide any other personal identifying information. Now, before we begin, we would like to recognize the Indigenous land that we're on. Inspired by the 94 recommended calls to action made by the Truth and Reconciliation Commission of Canada, land acknowledgements are a necessary first step toward honoring the original occupants of a place. They also help Canadians to recognize and respect Indigenous peoples' inherent kinship beliefs when it comes to the land, especially since those beliefs were restricted for so long. I encourage everyone to take a moment to reflect on that and acknowledge it. I acknowledge with gratitude and respect that I'm joining this meeting today from Newmarket, which is the traditional territory of the Haudenosaunee, the Wendat, and the Anishinaabe peoples. The Kidney Foundation would like to thank our sponsors for this 2023 webinar series: GSK Canada, Horizon, Otsuka, Paladin, and Merck. Their ongoing support allows us to bring many together like today to have broader, bolder, and braver conversations. Today's goal is to provide you with knowledge to help you navigate the financial implications of kidney disease. And now I'd like to introduce Kate Chong, who will be moderating today's session.
Awesome. Good morning, everyone, and thank you, Carrie. I am, as mentioned, Kate Chong, and I am the Director of Programs for the Kidney Foundation BC and Yukon branch. Also, I am a kidney transplant recipient of 6 years, and I'd like to welcome everyone for joining us today for the Tips to Reduce Financial Stress of Kidney Disease webinar. I also would like to acknowledge with gratitude and respect that I'm joining this meeting today from Coquitlam, BC, the traditional territory of the Coast Salish, Coquitlam, Tsleil-Waututh, Stalo, Kikite peoples. They are the original keepers and guardians of the lands on which I live and learn, work, and play. If you know the territory in which you are situated, I encourage you to acknowledge that in the chat. Quickly, as a disclaimer, the information shared in today's webinar is current as of today, September 12th, 2023. The materials shared in this presentation are not intended to be financial advice. The information provided is general in nature and does not necessarily cover all circumstances. While we make every effort to be accurate, we recommend that you seek professional financial advice for your individual questions. We are thrilled today to introduce our speakers. Thank you to all of them also for making time to share this important information today. So first, our first panelist today is Jody Max, has been working in a kidney transplant program at St. Paul's Hospital here in Vancouver, BC since 2015. She is currently serving as the BC representative of the Canadian Association of Nephrology Social Workers. Jody has been a social worker for 30 years, graduating from McGill in 1994 and UBC in 2013. Welcome, Jody. Next is Laura Quenneville, is a registered dietitian currently working in pediatric nephrology at Children's Hospital of Eastern Ontario in Ottawa, Canada. She completed her bachelor's degree in nutrition science at Montreal University in 2002. Laura has worked in both pediatric and adult hospitals, spending more than half of these years working in pediatrics, including 9 years in pediatric nephrology at CHEO. She is the Ontario's provincial director for the Canadian Association of Nephrology Dietitian, the Canadian National Network of Renal Dietitians. She has discovered her passion for pediatric nephrology over the years. Up to this day, Laura is working with dialysis patients, as well as in the nephrology outpatient clinics and with inpatients admitted within kidney-related diagnosis. So welcome, Laura. And last but not least, we have Patrick Ng, was diagnosed with kidney disease in late 2015. A few months later, after his diagnosis, he began hemodialysis treatments 3 times a week. While receiving his treatment, Patrick continued to work full-time in the financial services and investment management industry. In 2019, he received a kidney transplant, which he remains extremely grateful for. Patrick is also an active volunteer involving in several organizations, including the Kidney Foundation. His volunteering efforts and involvement in the Kidney Walk help raises to support the kidney community and to spread awareness about kidney disease. Welcome, Patrick. Thank you all for being here today. All right, so let's get into some questions here, and you will see the main screens of our 3 panelists today. So our first question we're going to kind of go through today and talk through is around asking for guidance to help is hard overall. How would you encourage someone to reach out? And I'm going to throw this to Patrick first, so please go ahead.
Greetings, everyone. Thank you for inviting me to be part of this webinar. It's an honor to be here today, and hopefully you find some insights in some of the experiences I can share with you as a patient. That's a very good question. You know, I have to go back to the beginning days of my initial diagnosis, and as many of you know, kidney disease can be quite a shocking situation to be diagnosed with all of a sudden. And in my case, I didn't really show any significant symptoms for quite some time until I actually was able to see a nephrologist. And surprise to me, I obviously had kidney disease. So obviously reaching out for guidance and help wasn't something I did very well. And so I wish I could go back in time and do that earlier. But you know, I would say the first stage for me was like anybody else is, you know, if you're reaching out for help and you don't know anybody who can give you that guidance, you know, I just went online at first and tried to find some information on what the doctor told me. And, you know, being a Canadian, I will tell you, it was a little more difficult because when I searched online for kidney disease and all the different things that go with it, you know, majority of things that come up are American based. So as a Canadian, it was a little more difficult. However, out of every 10 search finds I found, there's at least 2 or 3 posts that were supported by the Kidney Foundation of Canada, which definitely helped me initially to get a good understanding of what I'm dealing with, what is going to be entailed with the rest of my life going forward, and then expectations were set accordingly. But I would say, you know, reaching out to individuals that you're able to meet through your kidney clinic, maybe even if you're able to talk to other individuals who are going through what you're going through as well, is probably one of the most beneficial ways I found of learning and understanding what our expectations would be. And ongoing in the long term, that's where you're going to find a lot of that support and guidance, where it's easier to talk to people who understand exactly what you're going through. Of course, the biggest resource I had while there was the extreme work that was shared with me by my social worker regionally, as well as my dietitians, and of course, renal clinical staff in the local hospital or hemodialysis clinic as well.
Absolutely. Patrick, you bring great points around, it's a shocking going into, and as like yourself, kind of reaching out immediately to be like, what does this all mean? And one of my first places I reached out was actually to the Kidney Foundation. Of course, I did not work for them at the time. And, it was just kind of an outlet for me. So, reaching out to those that you do know, or even to Kidney Foundation at times can be super helpful around that. So thank you for that. Jody or Laura, would you like to bring in your perspective on it?
Thank you. That was really helpful, Patrick and Kate as well. I think I don't really have anything different to add. I do think, it's when it's really hard and uncomfortable, there absolutely should be a social worker available in your team that you can start with if it's just too uncomfortable to do anything else. And as both Patrick and Kate mentioned, the Kidney Foundation across Canada does have great resources. And one of the things they do offer is peer support. So there are trained peer volunteers who can absolutely talk to you. So that's also a good place to start. And if you don't know how to find that, your social worker can help you with that.
I really should have said that. So, I mean, that's part of my role here at our BC and Yukon branch is connecting people to other peers that might be going through that. And, that's the personal, just like Patrick, speaking to their personal experience and that sort of thing can be so beneficial when going through such a sudden life change, that sort of thing. Laura, I'd love to hear your perspective on this for reaching out for help.
Thank you. Yes, what I noticed is that it might be easier for some families or patients to open up to a certain healthcare professional or physician. So even if it's not a nutrition related question, sometimes I get a question out of my scope of practice, but I'll just redirect with the patient's consent to the right person. And then, it's okay. I just let them know, ask, you never know, and I may be able to help, or I'll find the person that can help you.
And that's the important thing, right? If someone within, if they're not sure, I know so many people within the renal world, let that be patients or staff members, or no matter where they are, they're willing to reach out and try to find that assistance in whichever capacity you're needing it. So, and I just see it popped up here as well on our poll, just the results from everyone that's online this morning. Just, how comfortable are people to reaching out and asking for help? And just love to point out that's, there are some that are extremely comfortable, a few more that are mostly comfortable. A majority of you are neutral to that, and then understandably, some people are somewhat uncomfortable or very uncomfortable, and that's totally natural in our ability. It's hard to ask for help. Let that be for your experience and or finances. Those are all things that we can be challenged to. So I think hopefully learnings from today is that you should feel empowered to ask for help. Or just ask for assistance. It's all super important. So that's great. Thank you all for that wonderful, insightful answers. Maybe we'll run into a question number 2. Possibly not able to work suddenly, and finances could be impacted quickly, especially for those living paycheck to paycheck. Where do people start to look for resources? And Jody, as our social worker today, I would love to throw that to you to take us through, because I know you get this all the time.
Thank you, Kate. Yes, this is a really stressful time when somebody is suddenly unable to work. So again, it depends on somebody's situation. We know we're talking to people across Canada. There are both federal resources, so available all across Canada, and then there's provincial resources that are specific. We always say the best place to start is to talk to the social worker with your team, because she or he will know what resources would be available to you specifically. So if you're working and you've got some sort of benefits, you can certainly look into your benefits to see if there's any short-term disability available or even long-term disability. We do have a number of kidney patients who are on long-term disability when those benefits were available to them. There's also federal CPP disability benefits that you could be eligible for. There are provincial disability benefits that you could be eligible for. If you're not suddenly experiencing disability to a level that qualifies you for that, you can start with medical EI if you qualify for that. So these are sort of some examples of what's available, but again, it really varies depending on your specific situation and where you are. Similarly, there's a lot of resources for folks in specific situations. So for example, if you happen to be fortunate enough to be a homeowner, there are tax breaks you can get. There's some disability accommodations you can get with your home. And again, that would be through potentially federal programs and potentially provincial programs. There's Indigenous specific supports available. Again, depending on where you live, the organization that would work with that would be different from province to province. We work with First Nations Health Authority here, and I actually thought it was Canada-wide until I just was looking it up this morning and realized it's BC. Since I work in BC, I know all the BC resources very well. Excuse me. And there are a number of other resources. The disability tax credit is something that many people can access. You actually have to earn enough money for it to be helpful. So if your income is extremely low, the disability tax credit won't really do much for you. But if you have been working and have earned enough money for that to be helpful, that could help. And an important point about the disability tax credit is to know to apply for it as soon as you learn that you are too disabled to work. And certainly if you're starting dialysis, that is the time to apply for it, because it can help you for as long as you need it until your situation may improve. If you were to get a transplant, for example, once you recover from your transplant, the good news is you're actually technically no longer disabled. So you would potentially no longer qualify for the disability tax credit. So occasionally we do have patients who come through the transplant program who had not already applied. So I always encourage people to apply as soon as you can for that. And then similarly, another program which is really great to start early on if you qualify is the Registered Disability Savings Plan. And Patrick might be able to add a little bit more about that. So I think I'll stop there. I hope I haven't talked too long there, but
no worries. No, that's also insightful. And I think the great thing is after today's webinar as well, we have a full list of resources for people that have attended this webinar that they will receive. So I'm sure a few of you are feverishly writing things down. So not to worry, there will be additional resources coming out. And Jody has definitely, put in a lot of the things that she just spoke about on there. So thank you. And, we are referring to everyone that's maybe within kind of either kidney care clinic, dialysis, transplant too. We may have some attendees today that may be just being still followed with their GP as well, or maybe just a nephrologist. So always just know, again, if you don't have like a full comprehensive team to, feel free to reach out to your GP as well, or, they might, if you have nephrology, that sort of thing as well. And I see as well some questions coming in. We will tackle those questions because who knows, some of our topics might actually answer those as we go through our series. So please put your questions and answers in there, which is fantastic. And we will make sure to get to those, or if not, we will follow up for sure. But we might get to some of these topics as we go through the conversation. Patrick, Laura, I would love to throw to one of you guys just to answer around suddenly not being able to work and, any resources or thoughts or experiences that you've had.
I'll take this one if you don't mind, Laura. Well, speaking from a patient perspective, I think everything that Jody mentioned is extremely valuable, and I highly recommend following her guidance. Keeping in mind, as Jody also mentioned, that some of these regional programs are based on provincial and federal. So make sure to speak to your regional social worker to get clarity on how that impacts you, where you're located, and perhaps what you qualify for. As a patient, I would say it was complete news to me when I first started my treatments that I was considered disabled. That's the first shocking thing as a patient is I'm disabled, okay, and I do qualify for the disability tax credit. And if I do qualify for that, then I should be able to qualify for access to the RDSP, or the Registered Disability Savings Plan. So the biggest change for me was recognizing that I was disabled, and there definitely were tax benefits and programs that definitely allow you to take advantage of opportunities to save money, to save your overall income tax reported every year, which puts you typically in a good position to, average some money into savings accounts, build an emergency fund, and use various opportunities to help grow your financial security on the stability side. And it takes a little bit of pressure off you, as they mentioned earlier, should you not be able to work right away or for an extended period of time. Now, from my perspective as a patient, I was very grateful that I did have short-term disability, and I did have long-term disability through my employer, and I pay for my own private plan. So when I got my transplant, I was able to benefit from that extended opportunity not to work for some time. But thankfully, my recovery went pretty cleanly, and I was usually back at work about 6 or 7 months after the transplant. So I was grateful for that. But I definitely encourage people to look on the Kidney Foundation website. There's lots of resources there giving you, details on these two options for you. Speak to your personal accountant as well. That was a very beneficial person I leaned on when understanding the disability tax credit and all the different opportunities I was afforded by qualifying for that status as well. And of course, speak to your family and friends about all these opportunities as well, because I know one of the benefits of the RDSP plan in particular, where as long as you're under 60, you can qualify the disability tax credit, you can open one of these accounts. But should you be a minor or a younger individual who's going through this disability status through kidney disease and treatments, you can have a guardian or a parent also consider opening an account for you, and you're the beneficiary, in which case contributions can also be made on your behalf. And there's definitely some benefits of using this account, because the government of Canada also allows you to qualify for a certain amount of grants every year. You make contributions. And now those grant percentages or qualifications can be based on your income regionally, but you could probably qualify for up to almost $3,500 a year just in Canadian grant money to be added to your plan tax-free for you as well too.
Wealth of knowledge. Thank you, Patrick. And I see your both your personal hat as well as your financial background hat coming in there. So thank you for that wonderful perspective. That's awesome. Laura, any insight on this aspect?
Yeah, maybe just a short suggestion. I do work in Ottawa, but we're really close to Gatineau. So we have patients from both sides of the river, Quebec and Ontario. So it's very different from one province to the other. So having a social worker in the team really helps to juggle with this. And from a nutrition point of view, if I may, ask your dietitian, because we can get samples often delivered. That's what I do, like delivered to your home. It may be just a one-time thing, but if you get a case of, I'm thinking Saplena, it's almost $100 for 24 cans. It helps. Maybe while we're writing letters to your private insurance, you may not be working, but still have insurance. We can write letters, social work or myself, I do it. And I go with appeals. If they say no, it's not a no for me. I just go again and write again and try to get coverage.
Right. Wow. Yeah, those are little tidbits that are so helpful, because yeah, exactly. And our next topic at hand is around food, and so you'll have a great insight on that. But those are the things when you're in this stressful time and trying to kind of figure out all aspects. There's small components of things, or yeah, when you look at your diet and that sort of thing, and you may need additional supplements in the sense of for nutrition purposes, and yeah, those add on top of your normal groceries typically. And so that's great insight. Thank you, Laura, for that. I just noticed our poll kind of popped up just so everyone knows who's kind of here today. So we have a little bit around newly diagnosed and living with reduced kidney function, hemodialysis, transplant, and a few family members here as well. So welcome to everybody. Oh, and some clinicians and other. So welcome everybody on that. And again, thank you for everyone continuing to put your questions in there, and we will tackle those here in a little bit. I'm going to move on to question number 3. And Laura, you're going to be in the hot seat first. Food inflation has really impacted patients' budgets, making access to healthier foods more difficult. As we know, that's important for everybody along their journey of kidney disease. What are some of the ways to access healthier foods and eat on a budget?
Thank you. Oh, my little slide. Thank you. So it's definitely not a myth. Prices in grocery stores did climb over the last couple of years, and unfortunately, they won't come back down like they were previous to pandemic. So we do have to figure out a way to reduce our grocery bill and to compensate for this increase. And let's add to that that patients with kidney disease might have a lot of food restrictions, which adds to the challenge of grocery shopping. So it is unfortunate, but some households did have to cut down on the amount of food they buy to be able to stick to their budget. And I was reading in an article from September 2021, so just at the beginning of the pandemic, that 50% of Canadians claimed to have reduced their purchase of meat product in the first few months, 6 months of the pandemic, because of it's way too expensive. Yeah, and suddenly coupons and flyers are popular again. So on that note, what you see on the screen, I did prepare little infographic, which should be available to you after with a bit more details, but the main subjects are there. So 12 tips to help you reduce cost when shopping for groceries. The first one, easy for me to say, but let's try to cook more at home. It definitely helps, and it gives you more control on what you eat. So if you have many restrictions, it may be a bit easier, but let's see the other tips. Tip number 2, if you use fewer ingredients, it's simple. It makes simple recipes, but it can be delicious and it will be less expensive. I added a link. Hopefully I can share. I'll share it with you in the resources. I'll find a way. But a grocery list. It's in English, but we could find a link as well of a pre-renal grocery list in French. So to make a list should help plan your favorite meals and also avoid impulse purchases and help you save money this way. To check the sales, many websites are available, like you can find sales flyers online, but I added, we don't see them here, but you'll have them in the resources, 2 apps that you can download on your device and can help you find the best sales. Let's say for an example, so the name of the apps are Reebee and Too Good To Go. And you can, let's say you need avocados. You'll type and search for avocados, and you create, while creating your account, just allow for your location to be known, and then it will show you the grocery, the stores around you that offers the least expensive avocados. So it's really great. Reebee is spelled R-E-E-B-E-E, and the other one, as I told you, Too Good To Go. Then tip number 5, frozen is okay, simply. Yeah, in season, some fruits and veggies will be less expensive, but if you want strawberries in the winter, it may be a bit more expensive, and they'll be as nutritive if you buy them frozen. No worries, just make sure that there's no sauce added or seasoning, because it could add some additives and sodium. Shop outer aisles. So yeah, going in the middle, that's where you find the products that contains more additives and have more ingredients, usually on the ingredient list. If you shop outer, you'll have fresh products, you will have more unprocessed food items. Then the make cost saving swaps. Yes, for an example, if you buy ground turkey instead of ground beef, it's usually less expensive. Or if you have the amount of meat in your recipe and add a bit of lentils to it, they're good lentils, but if you don't like it, you might not taste it because it's going to be mixed with some meat, with some beef. Frozen berries instead of fresh if too expensive. And then my tip number 8, eat less meat. Just replacing one of the meal in your week with a vegetarian meal can help reduce costs. And I have another infographic. I made a little handout with comparison between, I took tofu, beef, and lentils, just to show you the price per 100 grams, how it differs and how it's less expensive when we buy plant-based products. Number 9, stock up if you can, if you have room, if you have place. when on sale, buy 2 instead of 1. The non-perishable items will last longer. So if you can do this and have enough room to stock up, you do it. Reuse leftover. Yes, so if you can freeze what's left instead of throwing it, of course, it's going to be saving at the end. And be creative kind of goes with it. You can use the stir fry that you made yesterday and add a new ingredients to it to make a new meal. So be creative, add colors, add different veggies, different even fruits to your salads to reuse a recipe. And at last, make a menu. I'm not good at this. It's hard, but if you get the ball going, yeah, it's hard. It's easy to say, but if you make a menu, you can make it for 1 meal. So let's start. If you don't do it at all, do it for 1 day, I mean. And then you make your menu, you know your recipe, easier to make your grocery list and then go shopping. And then you might do 2 days in a week of a menu and 3. And that's fantastic. 3 days out of 7, I think it's a great goal. So that's for my tips. And yeah,
No, that's
anybody
amazing,
else-
Laura.
anything else to
Thank
add?
you.
Okay, thanks.
Yeah, no, absolutely. That's a visual piece like that is always so helpful when going through, and food's such a big piece. And it's so true. You go in and it's very true, right? The outside of the store is more the fresher product versus the processed. And, we see quite often, processed quite often is cheaper, but it's not as good or like as healthy for especially kidney patients. So that's, the great tip around frozen versus fresh sometimes on those off seasons. Because oh my gosh, I remember this last year a few times and I'm like, oh, that's really expensive for that amount, sort of thing. So very insightful around that. Jody, Patrick, would love to hear your guys' personal, of course, we all deal with, but then coming in, bringing in kidney and needing to watch diets and stuff, it can get extra nerve-wracking and frustrating and all that kind of stuff. I'd love to hear you guys' perspective.
Go ahead, Jody.
Oh, thanks, Patrick. Well, thanks so much, Laura, for that. That was really helpful. And I learned some very interesting things there. I happen to be a vegetarian myself, so I certainly encourage folks to do that. The one thing I did want to add, and I don't know Canada-wide how available these are, but there's community kitchens are available. Do they have them in your area too, Laura?
Yep.
Yeah. Okay, great.
Community garden too.
Community gardens, yes. So growing your own food is a great option, even if you have a balcony. I have a little balcony garden myself. So that's certainly very cheap and you can absolutely have total control over what you're growing there. But community kitchens are a great opportunity. They're basically a group of people who buy together, cook together, and then you get to take stuff home. So it can definitely be cheaper and it can also be a nice sense of community. And yeah, so I just wanted to add that. And then over to you, Patrick.
Thank you. Well, first of all, I got to compliment Laura. She nailed it across the board. So thank you for sharing that. I wish I had you to help me where I needed your help as well. But, I initially struggled with the dietary part of the requirements. And I'm sure most people on the call who are just starting their path down kidney disease and hemodialysis treatments are realizing this is way harder than I thought it was going to be. And your dietitian may not be your best friend in the first year because they're really on you to get your blood work proper. But I found, and this is my personality, of course, my personal situation where, I kind of just leaned right into it. And I said, this blood work is very important to me. And so I know what I should or should not eat. And so as Laura touched on, first thing I started off with, realizing what I should or should not eat, I tried to cut out everything I shouldn't be buying anyways, which is probably the largest expense of my monthly budget food-wise anyways. And I just focused on what meals I could start preparing. So I researched myself, buying a book on renal diet cookbooks and talking to my dietitian at the clinic as well, and my social worker, getting insights on that. So I really focused on meal planning and making certain meals that fall within what I need or don't need exposures to. And by doing so, I found I was already eating a lot of vegetarian-based diets as well, cutting back on my red meat intake. And you can easily find solutions on how to make meals that you taste good to, you're comfortable with, And in addition to that, once you stop buying things, you would tip the items there on a larger scale for cost savings there. But typically, you know, my taking my diet seriously and focusing on meal planning, and it doesn't have to be every day a special meal that makes me feel good, but I was able to just say, I need to eat this stuff, I need to eat less of this stuff. So I really catered to my weekly meal plan, and I just kind of stuck to a certain budget to do so. And it became, the next 2 years after I started that, it became a lot easier. And I definitely benefited from that by saving quite a bit of money in addition to that as well.
That's great. Thank you, Patrick. All very insightful information. And I knew this would be a great, comprehensive conversation amongst all of us, as, you know, we're all experienced that, let us, be kidney related or not. It's just an added level of financial stress at times when you're trying to eat right. So thank you. And of course, those additional resources will be shared. I'd love to jump to our next question, as we have about less than 10 minutes before we get into questions, because there definitely is some, which is great. But let's touch on transportation. Again, we're all across Canada here today, and so our distances for our medical appointments could be different. But transportation, depending on where someone lives, this could be a huge impact. Knowing things can differ from province to province. What are some resources or general ideas that you see? And Jody, I might throw this to you a bit too, because I'm sure within social work, you get this quite a bit around transportation and people, especially depending on what gas prices are too. That's a huge piece.
Absolutely. It's a really big challenge, especially for any of you listening in who live rurally, who don't live close to a major kidney center. So it's almost like there's two levels of experiences for kidney patients. Those who live in a big city who are close to a center have an easier time than those who have to travel to get care, obviously. So again, please talk to your social worker. She or he will know what specific programs may be available depending on your area. Every city will have some version of a disability transport service. It's often called something like Handy Dart. That's what we have here. But there also may be volunteer transportation services that you can access. Can be tax rebates through your federal taxes in terms of costs that you have to spend to travel, or if you have to stay in town for either, there's usually some sort of funding or tax write-off if you have to go for dialysis training or stay in town for transplant follow-up. So it's going to really vary from province to province and from location to location. So definitely start with your social worker to find out what's available to you.
That's great. Thank you so much. Yeah, sometimes looking within our community, there are amazing resources within individual communities that there are people that would love, now that COVID's kind of behind us now, let's say, might be more willing to help take a friend, a family member, someone to a medical appointment here and there. And so making sure to reach out there as well. Patrick, Laura, any insight on transportation?
Well, it's in the same subject, but I'm thinking parking passes. Check with the hospital.
Absolutely. Thank you. We have free parking passes in a lot of hospitals.
Yep.
Yeah, no, that's very right. Yes, Patrick.
Yeah, Laura touched on the biggest one I was going to say was I was able to drive myself to treatments regularly. So I qualify for a parking pass, which at first I felt guilty about because the hospital parking is already pretty busy. And I know a lot of staff don't get parking, but as I'm getting life-sustaining therapy, it made sense for me to be there for at least 4 or 5 hours every time I was dialyzing. So that was a benefit. I also know that I'm also located in British Columbia, like Jody. So she touched on some of the programs we have, like the Handy Dart bus service was very common and popular for a lot of dialysis patients in Kelowna when I was here. And I don't know if this falls under that program or not. Maybe Jody can correct me if I'm wrong, but there's also some patients who are getting tokens for cab rides as well, to and from the clinic or the hospital as well, which saves them a lot of money. And especially their seniors who don't have a supporting partner or family, that was very easy for them to deal with as well too.
Yes, absolutely. You're right, Patrick. So thank you, everybody, for adding all of that.
Yeah, no, that's perfect. Wonderful. Yeah, transportation is a big thing. And, if you do drive and you see the gas prices and they're down and you're like, oh, I just filled up yesterday. But, every little dollar counts when it comes to that. And we definitely see that when individuals, and also each, just from the Kidney Foundation perspective, of course, each province and the Maritimes are all kind of together. The Kidney Foundation, if we have short-term financial, so if someone lands on dialysis, now there is a financial criteria, but if you're in a kidney care, dialysis, or transplant, they can reach out to us through the social worker. And there are different programs, and it does vary province to province of what is available, sort of thing, for transportation, but definitely worth asking if there's any resources through the Kidney Foundation, even if it's short term, you have to figure out a game plan, but you now need to go 3 days a week to a dialysis center and you need a little time to get organized, sort of thing. Sometimes there's short-term transportation and or funding to help with that aspect of things. And some of our provinces also have actual dialysis transportation programs that people can access for financial assistance on there. So do stay in touch with your local Kidney Foundation office and branch, because there's great resources that might be available depending on, and again, it does vary across our wonderful country here. All right, we got a few minutes left before we open up to questions. So I'd love to hit up, because I know there actually was one around medication anyways. So let's jump into this next question. What type of resources are available for those maybe just coming into their kidney journey? Or I know the question was more based on already within their journey, and possibly new medication that comes, costs, let's say initial diagnosis. And then of course there's, as you go through your journey, your medication can change, especially post-transplant. I'd love to hear your guys' perspective of, like, is there ways to come around the savings of medication, because not everything's covered? Whoever would like to go first on that one.
I'm happy to jump in.
Jody.
Cool.
Okay, so again, I know I sound like a broken record here, but it really depends on which province you live in. For example, I can speak to BC. So transplant patients are very lucky here in BC, well, and dialysis patients too, because there are provincial organizations. So BC Renal covers all of people's medications when they're on dialysis. And then when they get a transplant, all their transplant anti-rejection medications are covered here in BC. I know that is not true across Canada. I don't know why it's not true, but I just did want to advocate that, kidney programs, doctors, social workers, patients, we're all advocating to try and make things more accessible to everybody Canada-wide. But in the meantime, talk to your social worker, find out what's available in the province you're in. There are provincial pharmacy funded programs, and there's some federal help as well. But, again, like in the BC context, we tell people to apply for something called Fair Pharmacare, but it's going to range from province to province. I don't know about most of the provinces. I do know in Ontario, for example, there's something called Trillium, where the social worker can help apply to get funding for medication costs. So, and again, as Kate mentioned, there is also some limited emergency help available through the Kidney Foundation. And, I will say that on your teams, the pharmacist and the social worker and the nurse, we're all going to be working together, dietitian, everybody, we're all going to be working together to get patients what they need. So if somebody can't afford their medications, we're going to do everything we can to make sure they get them. So there's sometimes our private funding things we can apply to if none of those other options work, just to bridge until a sort of more long-term plan is in place.
Oh, that's fantastic. Yeah, it's a big piece. And, I know, I also am in BC as well. And, there is still some of those not anti-rejection meds. We're very fortunate in that aspect, but, there's a few like blood pressure meds and that sort of thing. And there also, maybe I'll just throw in my 2 cents as well, because I know it can play a part, is there's the name brand and non-name brand of medications can also be a big cost difference. So when your doctor's saying, hey, you need to start this medication, say, hey, is there a very similar or exactly the same non-name brand that we could do, because it can save even tens of dollars at least per fill, sort of thing. I know there's one of mine that I'm kind of like, oh, okay, yeah, I could probably be saving, $20-$30 if I, got them to do the non-name brands, sort of thing. So always, that's my point when it comes to medication. Laura, Patrick, what would your insight?
I would just say, living in British Columbia, I can only echo what Jody had commented on. And so I definitely was able to benefit from a lot of the opportunities the provincial government was able to subsidize most of my anti-rejection, life-sustaining medications as well. I would also encourage people, if you do have other supplemental medications that are not directly tied to the post-transplant or during the dialysis process, some of those meds may not be covered under that. So I always double check my personal group benefits if I have any, to make sure there's any supplemental coverage for those kind of medications. If you're not sure about it, you can always reach out to the provider themselves or speak to someone like Jody or social worker at the clinic or the Kidney Foundation. They have lots of resources on that topic.
That's wonderful. Laura, anything from, you're representing kind of more the East today, resources that you know out that direction?
Make sure to tell the nurses, the team, because sometimes if I think Quebec, it's a code missing on the prescription. So they refuse to cover as a, there's the médicament d'exception, so exception medication form or something like that. We are in Ontario, doctors in Quebec will think about putting the code on the prescription, but our physicians may not think about it. So make sure you tell us which medication was not covered. So the, like you said, original or substitution. And I work with kids as well. And sometimes it's the form of the medication. So the liquid won't be covered. Are they able to swallow now? Can we switch to the pill? Yeah, you're going to save this way. So yeah.
Little things, right? Sometimes it just, naturally, or people are going around a process and there's little things that can say, then all of a sudden save. And, I do a note, and I know we're kind of doing questions at the end, but just because it's so insightful around, as we've talked about, I think just around transplant recipients, of course, with their medications, and some still seem to be having to pay lots of money towards that. So I would definitely encourage, if you are having that, continuing to follow up with your team, especially if that is becoming, an issue then too, because anti-rejection, all medications are important. You're on them for a reason, and your team wants you to take them. And so if you are having troubles affording it, make sure to talk to them to see what resources might be out there, because they want to make sure you're taking those medications, and it's very important. So chat with them around, is there something that, just by accident, a box wasn't checked on something, right? You just want to double check with that sort of aspect, because we don't want people to pay extra money for medication, that sort of thing. I know a couple of our questions were in relation to around medication. So it's not a perfect example or solution, but definitely hopeful to get you connected to those that might be able to help you along that process. Let's see here. So we're getting close. It's already out here at 9:48, so 12:48 out that direction there. So we're gonna pop into our questions here. And so I see a couple, and we've kind of tackled a little bit. So if a family member is taken to dialysis and needs a driver, can a family member get paid to take them? Was one of the questions around here, around transportation, etc. Any insights? So
I can jump in on that. So again, depending on the situation, family members can get EI caregiver benefits, and can actually get, that isn't the exact question, but it just made me think of that. They can get EI to have time off to be able to care for a family member who needs their support. And or there could be those tax benefits for transportation related things. So I don't think in terms of your question of somebody getting paid specifically to take somebody, I don't think so. But again, everybody's situation will be different. If it's a child and they're dependent on you, that may be very different. Or if it's a family member who has a developmental disability, there may be specific funding for that. But in terms of dialysis or transplant appointments that happen quite frequently, there should be a way to get some sort of caregiver benefits, at least for a period of time. Anything else to add, Patrick? Oh, sorry, Kate.
No, go ahead. I'd love to hear Laura or Patrick's insight. Sorry.
Yeah, I don't have a lot of experience with that topic, unfortunately, but I can only echo the one thing the call was exactly what Jody had mentioned just now. And so that's definitely an option, given your situation, to definitely speak to your social worker about, for sure.
Yeah, as we know, dialysis, of course, it's not typically a very short-term process. It's long, it can be sometimes months, years, decades for some individuals. And so there is that long-term planning that needs to go into place of how to get to those treatments or post-transplant, immediately there's a lot of follow-up and that sort of thing. And so sometimes, yeah, there's a lot of, love needed from family and friends, but, should look into other resources if that's not possible, that sort of thing. Laura, any insight on, sorry, guys, any insight on transportation or getting to and from dialysis and family members getting paid?
Not more than what you guys have said. No.
Fair enough. Wonderful. And one post says, my health plan does not cover hospital stay, which I was unaware of. Where can I get assistance? I'm not sure where this individual is located, but from Laura, Jody, from your guys' perspective, how does that kind of work?
So hospital stays should be free for any Canadian resident, whether permanent resident or citizen. So I wonder if maybe this is a question coming from somebody who's undergoing some sort of refugee or immigration status. If that's the case, again, please talk to the social worker who can help you. But hospital stays should never have a charge associated with them as long as you have provincial healthcare in whatever province you're in. And yeah, I think that's it on that one for me.
Laura, you unmuted. I'll let you.
Well, same. I was thinking maybe private rooms or
That's
like,
what I'm thinking too. Yeah.
Oh, if they meant private rooms,
I don't know. I'm thinking.
That's a different story. There's nothing to subsidize a private room stay for somebody if that question was about that. But if it was just to get care in a hospital, then that's what I was thinking that meant.
Patrick, any insight from your perspective as a patient?
That was exactly my experience. And I spent quite a bit of time in and out of the hospitals in the initial diagnosis and, fistula surgery and post-transplant. And never was I subjected to having to pay any fees to stay in the hospital under a provincial care plan and federal care planning as well, too. So.
No, that's very insightful. Yeah, the private room piece sometimes can play into it. So just as you're kind of going through post-transplant, they were pretty much, there wasn't many rooms that were kind of shared sort of thing. And I remember it did come up when I went to go have my children. It came up but I was at St. Paul's actually, and they don't have some shared rooms. I was going to be in my own anyway. So, but that's good to keep in mind, right? When you're going in, it's probably the last thing you're going to think of. But while you're there, it's good to make sure that you don't want an unexpected bill to show up following a hospital stay. That's not really, thankfully here in Canada, we don't have much of that for sure.
I did want to add that there is a federal emergency program for refugees in the country. So again, your social worker can help you apply for that, where people who have landed here under refugee status or even in the process of getting that. So there is funding available that would, of course, include medical care under that. So again, talk to your social worker, see what's available.
No, that's amazing. Thank you so much. Okay, so I think for the questions, those were the main ones there. If anyone else has additional questions, please put that in there. We are coming closer to the end of our time, but maybe let's, as panelists, I would love to just kind of finish out. We've had some great discussions around medication, transportation, food, just general reaching out for help. But kidney disease definitely affects the entire family. And outside of that family network of family and friends, there are many other community resources available to kidney families that they can turn to, both for just general, it could be someone that might need some time and help from others sort of thing. But this is a good kind of topic overall, and maybe a good kind of closing piece for each of us is, if you don't have a family and friend that's super close that can help, what other resources are out there? And I'd love for you guys to share any insights you have that before we do our final comments.
I'd love to tackle that one if you don't mind, Kate.
Yeah, please.
So I can definitely relate to patients who are early stage during the process of receiving transplant or during treatments. Is kidney disease can be a very isolating disease to deal with and live with. And depending, as I mentioned earlier in this conversation, if you have a good, strong support structure, family, friends, I found engaging with peers who are also going through what I'm going through was something I really benefited from. I mean, you can listen to your doctors, your nurses, dietitians, social workers, but at the end of the day, I'm the one in the chair or receiving dialysis or peritoneal dialysis at home or at the clinic. And it can be a very isolating situation, and there's going to be good days and bad days. So I really found reaching out to peers, if I was able to share experiences, talk to them, help each other out. It's always good to go through something together with people who are going through it with you. So initially, when I first started, there wasn't a lot of access to that readily available. And everyone has their own privacy concerns with their health and vice versa. But, in the last year or so, I've been fortunate enough to work with the Kidney Foundation, and we've kind of tackled a lot of these issues as a patient perspective. And so one thing we've created, which is I would recommend to everybody to sign up and check out, is the Kidney Foundation's Kidney Wellness Hub, which is newly created. We're welcoming anybody who wants to join the group. There's access to information about living healthy, diet and eating, mental well-being, as well as operating opportunities for us to socially connect, either rurally or vice versa, online. And they can connect you with people you can talk to, resources you can lean on as well. In addition to that, I know for those who use social media, there's also a Facebook group called the Kidney Friends Circle, which is also supported by the Kidney Foundation and members in the community. And basically, I signed up as a person who had kidney disease, and this group also provides some peer support, informative information sessions, updates on kidney events as well coming up to the foundation. So I'll definitely recommend both of those resources as things you should sign up for right away. And you'll get insights, information, and maybe meet some friends along the way to guide you through your steps as well too.
Well said, Patrick. That is the best spiel I've ever heard. So thank you for that wonderful insight on that, because it's true. And I know there was a final question that just came in around menu planning and on dialysis and eating out. And there's so many resources online. The Kidney Community Kitchen is a great resource as well that we have. So that's the Kidney Community Kitchen. It has its very own site. And there's lots of great resources that can be accessed either through the Kidney Foundation or even within each province. There's great resources around that as well. Jody, Laura, I'd love any final comments on that before we close up for today.
Thank you, Patrick. That was really helpful to hear you share about your experience and to promote the Wellness Hub. That was fantastic. I did want to just add that those resources that Patrick was just talking about are also available for family members as well. So the support is for everybody, whether it's the patient or caregivers or family members who are affected. And then there's also typically, again, provincially, sorry, it's going to vary, but there are caregiver support opportunities as well for those in a caregiver role. So there's usually some great resources available. Of course, there can be free counseling available as well for anybody who may need that. So just check with your team or the Kidney Wellness to see what you can find.
Amazing. Thank you, Jody. Laura?
Well, just thank you. It was very informative for me. I learned a lot, and I was happy to share my knowledges and experience. I just wanted to add that I did prepare a resource list with my favorite go-to websites, podcasts, and recipe, where to find recipes. So it will be available to all of you. It's not just this, but it's my favorite ones.
Amazing. Thank you, Laura, Patrick, Jody. Your guys' insight today have been so valuable, and I hope everyone has enjoyed that. So thank you for your time. The Kidney Foundation is committed to providing information and educational resources about kidneys and kidney disease. Through our regional branch offices, we offer advice and support about accessing services within the healthcare system, assisting people to access other support in their community, and offering assistance and skills for self-advocacy as well. We invite you to contact your regional branch if you have further questions, to speak with someone in your community, or to further educational material and resources. We are here to help. And Carrie, I'll let you finish off.
Thank you, Kate. Thank you, everyone, for attending today's webinar, Tips to Reduce Financial Stress of Kidney Disease. When the webinar ends, your computer will open a new page requesting that you complete our webinar satisfaction survey. And your feedback is important to help us improve our webinar series. So we would appreciate it if you would take a moment to complete it. The survey is available in both English and French, and you'll find the language toggle in the upper right-hand corner of your screen. On behalf of the Kidney Foundation of Canada, thank you for joining us today. Stay well and enjoy the rest of your day.